February is American Heart Month. The Division for Heart Disease and Stroke Prevention is encouraging women to listen to their hearts and speak up for their health. An upcoming docuseries next Thursday is in honor of American Heart Month and Black History Month. One of the key speakers, Khalil Adams, who received an open heart transplant back in December, he expresses the symptoms he faced.
My first sign was I was unable to breathe, and that was while I was at work, and this was roughly somewhere early in March of 2017. I just couldn't breathe very well. It felt like I was running when I was standing still. That was my first sign.
Joining us now, Tanika Rowland. Khalil, my goodness. Okay, so you are a fellow in an incredibly competitive program right now, which has positioned you very well to do this docuseries, but you didn't anticipate going down this path. It came out of a traumatic experience.
Absolutely. In 2017, March 31st to be exact, so that's coming up. My son, Khalil, he went into heart failure at the age of 21.
And when you think 21 years old, heart failure does not seem like a risk he'd need to be concerned about, right? And
Absolutely.
Picture of health, an athlete. What was this experience like for you?
Initially, it was traumatic. It's like, whoa, we're not raising our hand to go through this experience, but it opened the door for me to be able to bring more awareness to others. Because first it's like, why me?
Right.
But then it becomes, why not me?
Sure. And that is the big question that you're unpacking is getting testing, prevention. So going through a lot, I mean, it had to be just a terrifying experience in every way. You know, you're looking at your son like, is this it? And then he gets a heart transplant. So there is hope in your story.
Absolutely.
And when you think about how many people have gone through this that they didn't have his outcome, right? So what do you hope to accomplish with your docuseries?
Well, first of all, just to bring more awareness, and then also bring awareness to cardiovascular clinical screening and genetic testing. I believe that a lot of people aren't familiar with that. We're familiar with breast cancer clinical screening and genetic testing, but the cardiovascular, it's not as well known. And so my goal is really to bring more awareness to that and then start asking questions. Are we doing enough when we're talking about our athletic physicals? Are we doing enough to check the overall heart health? Is the stethoscope sufficient enough? Because we have so many of our youth that go up for that layup or that touchdown.
Very surface level physicals is what you have been through, and when that actually can lead to a life-threatening experience, we have to change things, right?
Absolutely.
How is Khalil doing?
He's doing very well. So you said a little over a year ago he received a heart transplant after living with a heart pump for 5.5 years. So that helped prolong his life.
And that's a life-changing adjustment as well. I mean, it's got to be just such a sobering experience. You see him going through that, but now you give hope because it shows you can recover, you know, to however someone's journey goes. It doesn't have to be just that abrupt change everything. So you see this, one of every 200 people have heart disease. That is a crazy number, and that is the leading cause of sudden death in young people. You know, can you speak to just knowing your risk can help you understand and help manage your health? You're talking about genetic testing.
Yes.
How accessible is that?
Well, it is actually more accessible, and most insurance companies do pay for it, including Medicaid, but the average out-of-pocket cost is only $200. But $200 could be a lot for some people if you don't have it.
Sure.
But it's not as much as many people may believe that it is. I will say that from my understanding from a local cardiologist that cardiovascular genetics testing has only been around about 7 years, 7 to 8 years.
What is the journey through this heart docuseries?
So with this docuseries, not everyone in this docuseries has a situation where it's inherited, but all of them, it was unexpected. And so we know that heart disease is the #1 cause of death in the United States. And then we also know that African Americans are twice as likely to die of heart disease. So I believe that prevention can help save families and also impact future generations. So I want us to start thinking about prevention and start doing the things that we need to do. Once we're aware, then we can start making better choices.
Education is empowerment.
Yes.
Where do people go? How do they find you?
So I am working with Iowa Public Health Association, so all my materials is on their website. All the information is available there. Clips of the docuseries will be available there as well.
Okay, beautiful. Thank you so much for being with us today, and thank you for turning a very traumatic, confusing situation into something that is going to save lives and is going to help people have these conversations that we can take responsibility for our health. You don't know what you don't know, right?
Absolutely.
Yeah, great
But
to-
now we know, so we can do better,
Oh,
right?
yes. Get to that docuseries. Thank you so much. Great
Thank
to
you.
have you. We're going to take